Recent findings by a Ministry of Health team indicate that the country's level of preparedness to handle a surge in COVID-19 is worryingly low. A draft report seen by Citizen TV shows that out of 281 facilities visited in 29 counties, a paltry 29% are considered sufficiently prepared to handle COVID-19 cases. This, even as the number of confirmed cases crossed the 16,000 mark after 667 new cases were recorded today. Gov't with the details.
A considerable number of public hospitals are not sufficiently prepared to handle the anticipated surge in COVID-19 cases. Health officials today alluding to a stretch on the available facilities, especially here in Nairobi, which is the country's main hotspot in infections of the novel coronavirus.
Yes, in Nairobi, there are days when our ICU beds have been full. But remember, across the country, we have about 400 ICU COVID beds that are available. And so, in terms of our assessment, we are not yet overwhelmed. We're still under the threshold of raising the alert level.
Preliminary findings by teams from Ministry of Health deployed to counties categorized in 11 clusters show that at least 70% of health facilities visited so far lack equipped isolation facilities, supplies, and human resources to handle a surge in COVID-19 infections.
But we are making every arrangement to improve the capacity also in Nairobi, because this is where majority of the cases are.
At the moment, there are 12,548 available isolation beds, 452 ventilators, and 460 ICU beds across the country. The preliminary findings by the technical teams carrying out assessments in the counties showing that more needs to be done to stem the surging COVID-19 numbers. The Ministry of Health team notes that Nairobi has a heavy reliance on non-public facilities to handle the COVID-19 pandemic. Overall ICU bed count per county is listed as low.
Teams are set up in 11 clusters. They are out there assessing counties and assisting counties to set up more facilities as we prepare for more patients, as we are starting to see our patients going up.
In today's figure, 667 people have tested positive for COVID-19, taking the total caseload to 16,268. Out of these figures, however, 7,446 have recovered. This means that 8,822 are active patients. An additional 11 people succumbed to the illness, raising the death toll to 274 since the outbreak of the virus 4 months ago. The first person who died of the disease in Gatundu constituency was buried today by officials from the Ministry of Health. Government spokesman Colonel Cyrus Oguna announced that he has tested positive for COVID-19 and is currently at an isolation facility responding well to treatment. As the numbers of new infections continue to rise daily, government is racing against time to enhance hospital facilities whose need is inevitable. Gov't, Citizen TV, Nairobi.